Welcome to the Untethered Airway Podcast, where airway health meets real-life impact. I'm Dr. Maggie Graham.
I'm Dr. Liz Turner.
And we're the moms and airway-focused dentists who founded the Untethered Airway Health Center. On this podcast, we're pulling back the curtain on the root causes of breathing and sleep challenges,
helping families and fellow providers understand how airway-focused care can change lives.
Because it's not just about teeth, it's about total body health.
Let's dive in.
Hi, everyone. Welcome back to Still Struggling, the Untethered Airway podcast series that I'm dedicating to taking a closer look at the overlooked signs of airway dysfunction in our kids' health, in their development and their behavior. I'm Dr. Maggie Graham. This is Steve the dog, who would not stop barking. And so he's joining me so I could get this recorded. I am a provider, a mom, and a patient, and I'm someone who's seen how often the most important clues get missed because we're told, don't worry, or they'll grow out of it. This series came in response to some harmful messaging that I got frustrated seeing in a string of articles published by Children's Wisconsin, who is seen as the end-all be-all when it comes to being a resource for children's health. These pieces minimize concerns about tongue ties, picky eating, ADD, trouble sleeping. They reassured parents without empowering them, and that really causes harm. That's not neutral. That's being dismissive, and it causes harm. Today, I'm going to talk about something that hits home for many families because of how much stress and emotion comes with it. Feeding challenges in infancy and early childhood. Because when a baby struggles to feed, or a toddler refuses to chew, or a kiddo is still on a soft processed food diet at age 7, it's not just a quirk. It's often a clue. And I don't want families to continue to bypass uncovering something so impactful. We think of feeding as getting calories in, but that's only part of the picture. Feeding is a complex motor skill. It involves posture, muscle tone, breathing, coordination, sensation, like integrating our reflexes, and so much more. So when a kid struggles, or baby struggles to nurse, if a baby or a kid gags on textures or avoids certain types of foods or refuses to self-feed, we need to ask, why is this happening? What is their body telling us? Bodies are so innately smart. Often, feeding issues are one of the earliest signs of orofacial dysfunction and airway instability. Let's talk about some early signs that point to function. Here are patterns that often show up when we're doing interviews with families or doing comprehensive exams. They'll discuss poor latches or painful breastfeeding. We'll see lip blisters. We'll hear clicking or swallowing during nursing or bottle feeds. The baby has constant reflux or frequent spitting up. They're fussy at the breast or the bottle. They're called colic. They have long, exhausting feeding sessions. They need to be constantly postured upright during or after a feed. They have milk dribbling down the corners of their mouth. They have a white coating on their tongue. They might have excessive gas or hiccups or constipation. The tongue might appear restricted and doesn't lift all the way. These are not isolated feeding issues. These are signs of poor oral function and often airway compensations. A really interesting study in 2020 found that infants with feeding difficulties were more likely to exhibit signs of sleep-disordered breathing within the first year of life. That is a really big thing to put together, that the kids that can't breathe well are the same kids that can't eat. And if you think about that, feeding and breathing go hand in hand. If a baby can't breathe well, they can't feed well either. They have to be obligate nasal breathers to feed from a bottle or from a breast. One of the most commonly overlooked contributors to the feeding challenges is tethered oral tissues, specifically tongue ties. And there's so much confusion about what's normal and abnormal. But when a tongue is restricted and it can't elevate to the roof of the mouth, it can't elevate to the palate, it can't support optimal suction, it can't support swallowing. And long-term, that low tongue posture, where the tongue lays low in the mouth, leads to suboptimal growth of the midface, narrow palates, narrow floor of the nose, mouth breathing. Despite what some articles claim, like the one that Children's Wisconsin published titled "To Clip or Not to Clip," this isn't just about a snip of tissue. It's not something to just be blasé about. Once you understand how impactful this is on the entire growth and development of the facial system, you'll have more respect for it. In 2019, there was a systematic review that showed that tongue tie releases improved breastfeeding outcomes and reduced maternal pain. When I was in the hospital with 2 of my 3 kiddos, I was told that it's normal to experience nursing pain and that my provider could write me a prescription for Apno or all-purpose nipple ointment. It is so accepted that breastfeeding is painful that we're missing pathology. We are literally ignoring it and just letting kiddos compensate, which is then going to lead to suboptimal growth and development. And we're letting moms suffer without taking the time to put together the pieces that matter, function and structure. We also know that it goes beyond just the latch. When we pair releasing tethered oral tissues with body work and functional feeding therapy, frenectomies can restore the optimal movement. The tongue can rest on the roof of the mouth and it can promote nasal breathing. Structure without function won't hold, and function without good structure is dysfunction. The baby will burn out and lead to other compensations. So let's talk about toddlers and big kids. The kiddo that refuses chewy or crunchy textures lives on beige or white foods. They gag easily. They take forever to chew and swallow. They refuse certain textures like meat or raw vegetables or hard sandwiches. It's not just picky. These kids are often compensating for poor oral tone, poor tongue coordination, and difficulty breathing. They're not going to eat things that makes it hard to clear the airway and makes it hard to breathe. A study published in 2023 found that feeding difficulties in early childhood were significantly associated with mouth breathing, low tongue posture, and altered craniofacial growth. We know that optimal tongue posture and optimal muscle function is what is going to drive facial growth. So that doesn't surprise me. We have to stop pathologizing children for avoiding food their bodies literally don't know how to manage. If chewing is exhausting, if swallowing is scary, if breathing through the nose isn't possible, of course they'll avoid challenging textures. It just makes sense. The body is so amazingly adaptive. Their food choices are functional, or rather dysfunctional. They're not behavioral. Let's talk about the link to growth and breathing. Feeding dysfunction doesn't just impact nutrition, it shapes the airway. Babies who compensate to breathe during feeding often have poor oral development, low palate formation, and weak or dysfunctional swallowing patterns. Those swallowing patterns affect pressure in the mouth, which is how the palate forms. It's literally how the face grows. The roof of the mouth, the jaw bones, the midface. And as they grow, these kids are more likely to become mouth breathers. They're more likely to snore, clench and grind their teeth. They're more likely to struggle with sleep quality. They're going to have neurologic development issues. They might have behavioral issues. There was a study in 2017 that confirmed that early feeding dysfunction was associated with later development of pediatric obstructive sleep apnea. That's huge. There's papers out there that are almost 10 years old. This is not new. This is not about preference. It's about physiology. So when the research is out there, when we're seeing it every single day in practice, then to dismiss it or to say that it's not real is so harm causing that it makes me want to scream. It's so frustrating. So what, as a parent and as a provider that's talking with patients all the time, what can you look for? Here's what I'd love more parents and providers to screen for. Did the baby or does the baby struggle to latch or transfer milk? Is there a supply issue? Does mom have pain? Are there lip blisters? Was feeding stressful or prolonged? Did they have a hard time transferring milk? Did they have a hard time gaining weight? Did reflux persist? Was there early picky eating or sensory aversions? Does the child have open mouth posture at rest or during sleep? Did they sleep in funny positions? Are their lips dry? Are they cracked from chronic mouth breathing? These are all things that can point us into the direction of an underlying breathing disorder. Do they refuse foods that require chewing? Do they drool excessively, or do they have unclear speech? Each of these is a signal. Each one of these tells a story about function, tone, and airway. We just have to start listening. Now, a baby might not, or a kid might not come in with all of these symptoms, but pay attention. Open your eyes and start to think of things differently. So what do you do next? What can you do if this sounds familiar? Start with observation. Watch your kids eat, watch them breathe, watch them sleep. You'll be amazed at what you can notice once you're tuned in. And then I really encourage you to realize the body is so amazing. All of these dysfunctional things, all these picky eating tendencies, as stressful as they are, and I don't want to be dismissive of that, are amazing. And the reason why I say that is that the body is amazingly adaptive. So let's celebrate that we're uncovering these things, and now let's do something about it rather than just ignoring it and letting these things become chronic issues. chronic issues that cause the need for medical intervention, cause people to suffer and not connect the dots. I would encourage you to seek an airway-informed provider. Get an evaluation that might include a myofunctional therapist, an airway-focused dentist, maybe an airway-focused pediatrician, body workers, feeding therapists trained in functional and structural assessment. They are out there, but unfortunately you have to find them. It's not how we're trained, and it is not commonplace yet for our medical providers to be preventive mindset. They're out there putting out fires because that's the way we're trained, and that's what's keeping us busy. Intervene early, but not in isolation. If a release is needed, if there is a tongue tie, pair it with therapy, pair it with body work. Don't just do a clip and go, because while you might have identified something that somebody else is dismissing, it comes with its own set of issues. Feeding issues aren't just picky eating and bad habits. They're often the first sign that a child is struggling with oral function, breathing, and growth. Let's stop saying they'll eat when they're hungry, they'll grow out of it, or they're just stubborn. Let's replace those with, what's this child's body trying to tell us? Where is the compensation coming from? What would change if this child could breathe better? When we ask better questions, we give better care. And when we treat function early, we don't just get better eaters, we get healthier kids that turn into healthier adults. Thank you for being here. Thanks for sticking through this with me. And in our next episode, we'll talk about open mouth posture and why it's not just a habit and how it affects growth, regulation, and sleep. Until then, keep looking closer. I'm Dr. Maggie Graham, and this is Steve the dog. See you next time.
Thanks for tuning in to the Untethered Airway Podcast.
If today's episode helped you see things differently,
Please share it with someone who would benefit from hearing this. And don't forget to subscribe.
want to learn more about airway health or connect with our team?
Please visit our website, untetheredairwayhealthcenter.com, or follow us on Instagram @untetheredairway.
Until next time, bye.